Hello, my name is Barry Murray. Today I'm going to be talking a little bit about DKA, diabetic ketoacidosis. This is for Daytona State College, Nursing Process 4 and Lab for Professor Horvath, July 27, 2021. About the definition and pathophysiology, DKA is caused by uncontrolled hyperglycemia, metabolic acidosis, and increased production of ketones. It's a serious condition that can cause a coma or even death. Some typical signs and symptoms for DKA can include dehydration, tachycardia, orthostasis, fruity breath, that acetone fruity breath, Kussmaul breathing, mental statistic changes, polyuria, polydipsia. Some admission rate information: 1 in 5 type 1 diabetics are hospitalized for DKA. Women are more than likely to be readmitted than men. The reason for that is unknown. 91,000 DKA-related hospitalization per 2017 database. 20% readmission within 30 days. Talking about pediatric DKAs, 30% of children present with DKA at the time of their type 1 diagnosis. Children younger than 5 will usually have a delayed diagnosis. And children older than 5 usually present with the typical polyuria, polydipsia, vomiting, dehydration. Large volumes of fluid administration can be harmful to peds. IV fluids should be given cautiously, unlike the adult DKAs. No insulin boluses are indicated in pediatric DKAs. IV fluids and potassium levels are required before insulin is given. Some information about lab findings. DKA always has the presence of three of the following: hyperglycemia, glucose above 300, ketosis, and acidemia, which is the pH is below 735. Some diagnostic tests for DKA include basic metabolic panel, osmolality, hydroxybutyrate, complete blood count with diff, urinalysis and urine ketones by dipstick, and ABGs. The number of type 1 diabetics in America is 20 Caucasians per 100,000 population. Caucasian DKAs are statistically higher compared to African American, Hispanic Americans, and other ethnicities. 15% of the diabetic population is type 1. There is no cure, and daily insulin injections are required. Autoimmune cell destruction can begin years earlier. It is believed to also come from possible viral infections early in life. Talking about complications of DKA, we have metabolic and non-metabolic. Metabolic being acidosis, hypokalemia, and hypocalcemia. Non-metabolic include infection, septic shock, vascular thrombosis, pulmonary edema, cerebral edema. Long-standing type 1 diabetes can cause hypoglycemic unawareness. This typically occurs in people who have type 1 for over 30 years. This puts people at a higher risk for slipping into a coma. Some complications. DKA usually, almost always, causes AKI in hospitalized patients. Acute kidney injury is highly prevalent among children and adolescents. Volume depletion is a major cause of AKI from DKA. An A1C is a blood test that measures your average blood sugar levels over the past 3 to 4 months. This helps nurses and docs to see how well you manage your diabetes. This is an A1C chart that I've included, giving you some numbers for people's A1Cs. Some medications and treatments for DKA: constant insulin drip. Usually we will see the glucomander. Electrolyte replacement, fluid replacement by IV is one of the first line things we do. Medications for underlying illnesses causing the DKA. Some more medications and treatments for DKA. We normally put people on NPO, no food or drink. We usually keep them until their lab values come back to a normal level. We normally give sodium bicarb for severe DKA, and blood sugar checks are usually Q1. Nursing interventions. The main interventions for DKA include administration, assessment, checking cardiopulmonary status, also checking their mental status, discharge, educating the patient and family caregivers, and making sure they follow up with their appointments. Patient, family, caregiver education, reading labels, counting carbs, discussing treatments, getting established with an endo, education on insulin preparation and how to administer, and encouraging participation in support groups. Some additional information to give the patient before discharge about when to go back to the ER. When they have high urine ketones, blood glucose levels are greater than 300 after 2 to 3 readings, they experience any shortness of breath and have any vomiting. DKA prevention. Check blood sugar often, especially when sick. Keep blood sugar within targeted range. Take all medications and consult physicians regarding any insulin changes. Lastly, talking about death rates. Death rates for males and females differ just slightly. The cause for this is unclear.